Well, good afternoon. We're all making sacrifices in the fight against this virus because this enemy can only be spread as far as we allow it. And isolating this virus is the best tool we have right now. But using this tool comes with a heavy price. And we're all sharing this burden. We're all paying a price, but I want you to know that your efforts, that your collective efforts are paying off. We saw in this week's modeling that community spread is heading in the right direction. That's because we're all doing our part. People are staying home, self-isolating, and our businesses have stepped up in a big way. Businesses across Ontario are paying a heavy, heavy price to put their people and their communities first. And our small and medium-sized businesses are the backbone of our economy. They're the cornerstones of our communities. Our restaurants, bars, our hospitality and tourism sector, our mom and pop shops, they've been among the hardest hit. And we all have to do everything we can to support them. We're allowing bars and restaurants to sell alcohol with their delivery or takeout orders. We've delivered $10 billion in tax deferrals, WSIB relief, and other supports. And we worked with the federal government to provide loans and wage subsidies to help these businesses stay afloat. This is a strong start, but we can and we will do more. We will leave nothing on the table when it comes to supporting Ontario through this, and today, more help is here for our small businesses. We're delivering emergency commercial rent relief to our Ontario small businesses and landlords. In total, over $900 million will go towards helping these businesses make rent and keep people employed. And I know it's not just businesses paying rent, it's many residential renters as well. And with May the 1st around the corner, many tenants are feeling anxious about the rent right now. I want to be very clear. If you're working, if you have an income, if you're able to, you must pay rent. But for the countless of people out there, for those who have had their livelihoods impacted, for the workers who've lost their jobs, we will have your back. We have frozen evictions so you won't lose your home. And today, I will ask the Prime Minister to work with us on a program to support residential rent tenants. I want to thank Minister Clark for his work pushing the federal government for residential rent relief. My friends, we're doing everything in our power to help Ontario adapt to the new reality. And now we must begin the hard work of recovery. Early next week, we'll be releasing our framework for reopening Ontario's economy. It will provide a gradual and measured approach to opening up. Let me be clear, the health and safety of Ontario will always come first. I want to thank all of our wonderful small businesses, our cooks, cleaners, and restaurant staff. Thank you to the people who keep food on our tables. Thank you to everyone who is putting others first by staying at home. We're working around the clock for all of you. We will get through this together, and thank you, and God bless the people of Ontario. Now I'll invite Minister Phillips up.
Thank you, Premier Ford, and good afternoon. Under the leadership of Premier Ford, Minister Elliott, and Minister Fullerton, we have taken decisive action to stop the spread of COVID-19, and so have the people of Ontario, including the business community, who have gone above and beyond to do their part. But we know that some of the necessary measures put in place have come at a cost, especially for small and medium-sized business owners. In particular, we've heard from commercial tenants and their landlords about the challenges facing these businesses as they experience challenges paying their rent. Support is urgently needed. And that is why we're partnering with the federal government to deliver the Ontario, Canada Emergency Commercial Rent Assistance Program. Our government has committed $241 million to deliver urgent and much-needed relief of more than $900 million to Ontario business tenants and their landlords. To receive this support, property owners will be required to reduce the rental costs of a small business tenant by 75% for April, May, and June, and commit to a moratorium on evictions. By providing support now, we'll help small businesses get through this challenging time so that they can be part of the recovery when the province reopens. I would like to thank the federal government and my counterpart, Minister Morneau, for joining us in this important investment. We've worked with the federal government to bring commercial rent relief, and when they stepped forward, our government didn't hesitate to partner in a meaningful way to provide support for our small and medium-sized businesses. I will continue to urge my federal colleagues to ensure rental relief arrives as quickly as possible. It cannot come fast enough. Today's commitment builds on Ontario's action plan, Responding to COVID-19, which provided $17 billion in relief for people and employers. As the Premier mentioned, the action plan includes $10 billion in cash flow support for businesses so they can keep employees on the payroll and the lights on in their businesses. From eliminating the employer health tax for 90% of businesses in this province, to deferring payments and interest on provincial taxes, WSIB premiums, and enabling property tax relief. At the new Ontario Jobs and Recovery Committee, we have already started to plan for the next phase, Ontario's action plan, Reopening Our Province. This team will work together to get our economy moving again, with a focus on job creation, opportunities for growth, and protecting our province from future threats. I want to conclude by encouraging everyone to continue to follow the advice of our public health officials. As I've said before, I was confident in Ontario before COVID-19, and I remain confident today. Thank you.
Well, before I take questions, I just want to mention that at 1 o'clock, we'll be joining the rest of the country in observing a moment of silence for the victims who lost their lives in the terrible tragedy in Nova Scotia this past weekend. My heart breaks for the families and loved ones, and I want them to know that you're all in our thoughts and our prayers during this extremely difficult time. We'll take questions now.
We'll go to the phone line. First question.
First question comes from Cynthia Mulligan from City News. Please go ahead.
Hello, Premier.
Hi, Cynthia.
I think I'd like to start. I'm sure I speak for all of the gallery where we offer you best wishes for your family after the news about your mother-in-law.
Well,
yesterday.
thank you. Thank you, Cynthia.
Okay. I actually have a question for the health minister,
Yes.
please. Minister, we know that thousands of surgeries have been canceled in the last month, 1,700 cancer surgeries, for example, thousands of other types of surgeries. I know you're talking about getting this back online, but are you worried that there will be a lot of collateral damage to people that don't have COVID-19 but will still suffer the health consequences?
Well, I know that there are many people who are waiting to have surgeries performed, from orthopedic surgeries to more pressingly cancer surgeries. This is something that I know is extremely anxiety-provoking for many people. They're worried about their own health and safety, but the decisions were made based on a pandemic plan that was developed by Cancer Care Ontario. So those are the cases, however, I would say that we are going to be returning to as soon as we're able to start resuming elective surgeries once again. But because we're still in the peak of COVID-19, we still are getting numbers in over the 500s, in some cases over 600s on a daily basis, that we need to make sure that we are past the peak so that we know that we will have the hospital capacity that we need in order to get back to these surgeries. But we are planning for them already, and as soon as the Chief Medical Officer of Health gives us the indication that the peak has passed, that we will be starting those surgeries again immediately.
Do you have a timeline for that? Is that possibly weeks? And I know how incredibly busy you are and focused on COVID-19, but are there things that you haven't been able to get to that are falling through the cracks? For example, cystic fibrosis patients. Before this all hit, they were begging for a new medication that could be potentially life-saving, and yet they are so incredibly vulnerable to COVID-19. Have you been able to push that forward through at all?
We're continuing to work on all of the other files that are important in health. I think with the cystic fibrosis medication, that is something that several of them haven't been passed through Health Canada as yet. So things have been slowed down, as you can, I'm sure, understand because of COVID-19, but we are still continuing that work, and that it's very busy with the COVID-19 issues, but the other issues are important to many people as well. So we are continuing to work on them, and when the Chief Medical Officer of Health tells us that the peak has passed, we'll be able to resume many issues, including the elective surgeries, including the work on some of these other important files as well.
Next question.
Next question comes from Alison Jones from the Canadian Press. Please go ahead.
Hi, Premier.
Hi, Alison.
On the commercial rent release program, the Canadian Federation of Independent Business is raising some concerns that the program is too reliant on landlords, that it will go through them rather than the businesses themselves that need help. How did you, in consultation with the federal government, arrive at the decision to make it operate this way?
Well, I'll pass this over to the Minister of Finance. He's handling that file. Thank you.
Thanks very much for that question, and we have been in frequent contact with Dan Kelly at the CFIB, and the program design certainly took into account many of the considerations that CFIB and small business owners across Ontario and Canada had in place. The important part of partnering with the landlords is that we are expecting them, as part of the program, to take 25% off of the rent. So they are an important partner in this. It also ensures that we can cover the broad swath of businesses because almost everyone has a landlord. So the structure of the program was meant to make sure that, in our case, we think there'll be hundreds of thousands of businesses in Ontario that will be able to take advantage of this. It was also meant to ensure that everybody did their part. There is an expectation that the small businesses will pay 25% of what they would have been paying, and that the landlord will be getting a substantial component, 75% of their expectation. But this was designed to be able to be implemented quickly. That's why we use the CFI, or the Canada Mortgage and Housing Corporation, as the delivery mechanism. They have relationships because of mortgage insurance with 98% of the landlords already. So very much designed to be comprehensive, be able to cover the majority of the businesses that we're targeting, and that the money could be delivered quickly.
Thank you. And for, I guess, either the Premier or either of the other ministers on the military assistance for the 5 priority long-term care homes, what was the criteria used to decide which 5 homes to deploy to first? Some of the ones in the list obviously are not even close to the hardest hit in terms of numbers of deaths.
Thank you for the question. So we've been really monitoring very carefully the status of all our homes and looking at who is in greatest need. The staffing appears to be the main area of severe concern right now, and that is a major part of how we've determined to go with these 5 homes. But this is an issue that is changing, and so if other areas, other homes need assistance in this regard, more will be deployed.
Next question.
Next question comes from Haley Cooper from News Talk 1010. Please go ahead.
Hi, Premier.
Hi, Haley.
We've learned that Fiat Chrysler is planning on restarting production in the U.S. and Canada, including the one in Brampton on May 4th. And we just wanted to know how much consultation was done with your government and why this date was selected, because employees and their union have expressed grave concerns about this early restart and their health and safety. So what can you say to calm those concerns?
Well, I guess that's when the automotive industry right across North America is open. We've been consulting with the automotive part manufacturers, along with the automotive manufacturers themselves. I just got off the phone yesterday with the president of Toyota as well, and the supply chain won't move forward without the support of the region of North America. I have full confidence in the first of all, the unions and non-union automotive part manufacturers and the actual auto manufacturers themselves. They're very, very responsible organizations. They aren't going to jeopardize anything when it comes to health and safety, and I've heard that right from the president and CEO of many companies. They're going to make sure that they practice social distancing, they have proper PPE equipment for all their employees, and I've been through a majority of all the plants. They're very, very clean, well organized, and nothing is more important to these companies than the health and well-being of their employees. And I know that they're in communications with their unions, so I'm sure they'll be able to work things out and have a very safe working environment.
And Premier, we hear you every day speaking about just now health of employees, the health of the people of this province, and we want to know how you're doing. You're working day and night. There's so much pressure on your shoulders. You've expressed that your mother-in-law has tested positive. So how are you caring for yourself mentally and physically?
Well, I appreciate it. I'm fine. I feel, knock on wood, healthy as a horse right now, and it's not about our family. It's about the 78,000 families and long-term care and what they deal with day in and day out. It's about families that are worried about rent on May the 1st, and they've lost their jobs. Sometimes there's a couple, both of them lost their jobs, and they have 3 kids. That's what you call pressure. When you can't meet a mortgage, they're finding it tough to put food on the table. But I appreciate it, but believe me, it's all about the families. It's about the frontline healthcare workers over at West Park and every other long-term care facility that are risking everything, going in there day in and day out. And that's all I think about all day, all night, is how we're going to get through this, how we're going to support the people of Ontario. And as Premier, that's my job, to protect every single person, to make sure I advocate to the federal government and push the federal government, for instance, on rent. Rent alone, we're doing it with businesses now. We need to do it with the tenants and landlords for their residents. And landlords, a lot of them aren't big landlords. They're just hardworking people that might have a couple units, and they're trying to survive. And I want to thank, the federal government for all their help. They've been great, by the way. They've been absolutely fabulous. But we need more. We need more for residential rent. I know the Prime Minister mentioned about long-term care yesterday in the military. I need his help. Prime Minister, if you're listening, I need your help on long-term care. We need funding. And if we can provide funding, that will help us get through this and have a better, more sustainable long-term care facilities. So that's all that's on my mind, 24/7, literally 24/7. But thank you so much for asking.
Next question.
Next question comes from Mike Crawley at CBC News. Please go ahead.
Hi, Premier. Just to pick up on long-term care and your requests to the Prime Minister on the funding side of things, you've mentioned previously about the possibility of topping up the pay of long-term care workers, I guess in particular personal support workers. Any sense of when that's going to happen, how much it's going to be? Because we've been hearing reports that personal support workers are leaving, going to other minimum wage jobs because where they don't have to put their lives on the line.
Well, we're going to take care of them, Mike, and nothing's a tougher job than what they're facing right now. Just imagine having a loved one, husband, wife, brother, sister, that has to go into this job every single day. They're absolute heroes, and I just want to tell them that help is on the way. Our Minister of Finance is working on a program right now, along with the help of the federal government, and that will be released very shortly.
And then my follow-up, Premier, when you look at starting to ease some of the restrictions, maybe allowing some non-essential businesses to start to open, have you given any thought to whether the phase-in might happen differently in different parts of Ontario? because it seems that the pandemic isn't having the same level of impact in Northern Ontario as it is in Southern Ontario, and people in the North are wondering why the same solutions need to be imposed necessarily on them when the life in the North is so much different. So is there a possibility of some sort of slightly different regional phase-in of lifting the restrictions?
Yeah, great question, Mike. We're dealing with almost two different worlds. You have the urban and you have the rural areas, but we're all connected. The problem with that, Mike, and I fully understand what you're saying, and I actually agree with what you're saying. We just can't risk someone in Toronto going up north. But what I'm going to do is I'm going to pass this over to the Minister of Finance. He's putting a package together. Thank you.
Thank you, Mike. So as the Premier mentioned, we will be releasing, Minister Elliott, the Premier and myself, the framework that will speak to those very questions. But as the Premier touched on, obviously we are experiencing in the suburban and urban areas different realities of community transmission than they are in some of the more rural areas. The considerations are absolutely the movement of people and the fact that people could move and may in fact be incented to move from one area to another based on differential restrictions in some of those areas. But this is absolutely what the framework is considering. We're getting the very best health and science advice as well as looking at it from an economic perspective. And as you will see, I know Saskatchewan, I think to their credit, they are further ahead in terms of their COVID issues, released a document. This is an issue that all of the provinces are going to need to be considering because of the nature of the size and scope of our provinces. I should mention as well, of course, you open up issues around cross-border. We're in conversations. There are two clusters of American states in the sort of New York-related cluster and then a Michigan and Midwestern cluster. So all of these are part of the complex considerations that will be part of the framework that comes together. But as always, I have to end by saying it'll be based on the best health and science advice and making sure that we protect the safety of Ontario workers. And I should mention, the Premier mentioned about Fiat Chrysler, that conversation before. One of the areas where there's a great deal of work being done is by our Minister of Labour and Skills Development, Monty McNaughton, in the Ministry of Labour, designing the sort of skilled or sort of safe workplace requirements and expectations with our health professionals so that workplaces will have the sort of guidance that they need to open up those workplaces safety, whether it's for the workers or for customers in some settings. Thank you.
Next question.
Next question comes from Colin DeMello from CTV News. Please go ahead.
Hi, just a question to the Premier and the Finance Minister about that framework that's coming up next week. How closely are you going to be watching Saskatchewan's rollout of their restarting of the economy? And could Ontario have a similar kind of 5-step plan just like Saskatchewan has?
Well, as we've been saying, Colin, the first priority is making sure we protect the health and well-being of the people of Ontario. And as you know, Saskatchewan has such a much smaller population, a large area, a lot of farming communities as well in Saskatchewan. And I just got to tell you, I think the world of Premier Scott Moe. He's one of the champions of all the premiers. We get along very well, but we always look at other models right across the province, and actually we look at models right around the world, see what's working, what's not working, and take the best ideas off them.
Okay, and just to follow up, Premier, Quebec has asked for 1,000 more members of the Canadian Armed Forces to come in to help shore up the support that they already had. So I know Ontario has 250 now. Could there be a possibility that Ontario would need more members of the military to come in to help more beleaguered long-term care homes as we are continuing to go through this crisis?
Yeah, I had a good conversation with Premier Legault last night, and boy, they're in tough haul over in Quebec right now. We just shared advice back and forth. But right now, we've asked hospitals to get involved, public health to be involved, volunteers, retired nurses to come back, as well as the military. But we had a good conversation today. with long-term care and the plan moving forward. We have a solid plan. So right now, Colin, to answer your question, we're all right. Again, I'm so grateful for the military. These people are incredible, and I mentioned it yesterday, but when General Vance said, Premier, send me in the toughest places that you have, they're incredible. They're heroes, are men and women, part of our military. Absolutely amazing. So we welcome them with open arms. And I just want to wish Francois Legault all the best in Quebec. We think we have a tough time here. It's a lot tougher in Quebec, and he needs the resources. And again, I'm going to repeat my request to the Prime Minister that both Premier Legault and myself will ask the Prime Minister for support in long-term care. We all agree, military shouldn't be their full-time job on this end, but we need funding off the federal government. And again, I want to thank the federal government. We are so grateful for all the funding they've given us so far. They've been true partners. So thank you.
Next question.
Next question comes from Julianne Lamoureux from Radio Canada. Please go ahead.
Yes, hi, good afternoon, Premier.
Hi.
Well, to follow up on that, the Prime Minister said that maybe we should have a discussion whether the long-term care home should be part of the health system or if they should be dealt with under the Canada Health Act. What do you say to that?
Well, I'll pass this over to my Minister of Health or long-term care, either one who wants to answer.
So if you look historically at how our healthcare system and our long-term care system and our pharmaceutical system evolved, it was the medical care, the hospital care that was covered under the CHA or the Canada Health Act. Neither long-term care or pharmaceuticals were. Of course, we're facing an aging population, a population that has more needs and more requirements, and we're really just at the very, very beginning of an aging population, which will go on for a number of decades. So we are looking at how we can reform long-term care. Our ministry was very active, involved in creating a vision for a modern 21st century long-term care system that treated residents with dignity and respect, and that was supportive of our caregivers and our staff. So this is an ongoing dialogue we'll need to have, and obviously we would be very grateful for federal input at this level. Thank you.
Okay, we're going to pause now. It's just about 1 o'clock, so we will pause for 1 minute for a moment of silence. Thank you.
Thank you, everyone. We're going to wrap up? Okay, thank you, everyone. Thank you.